Full agonist and partial agonist. Partial agonists. Other drugs, called partial agonists, bind to the same receptors and activate them in the same way, but do not evoke as a great response, no matter how high the concentration, because they have no intrinsic efficacy. Intrinsic efficacy is independent of affinity for the receptor. Look at this table. Drug groups according to affinity and intrinsic efficacy. Alpha represents intrinsic efficacy. Full agonists. Full agonists have affinity and intrinsic efficacy. Alpha equal to 1. They could bind to the receptor and induce effect. Antagonists. Antagonists have affinity but having intrinsic efficacy. Alpha equal to 0. They could bind to the receptor but couldn't induce effect. When they bind to the receptor, they could compete with or prevent agonists to bind to the receptor and reduce the agonist effect. Partial agonists. Partial agonists have affinity but have lower intrinsic efficacy. Alpha between 0 to 1. They could bind to the receptor but produce a smaller effect. If full agonist intrinsic is 100%, partial agonist intrinsic efficacy is less than 100%. So, is alpha between 0 to 1. Full agonists, antagonists, and partial agonists. Full agonists have affinity and intrinsic efficacy. They could bind to a receptor and induce effect. Antagonists. Antagonists have affinity but having intrinsic efficacy. They could bind to the receptor but couldn't induce effect. Partial agonists. Partial agonists have affinity but have lower intrinsic efficacy. They could bind to the receptor but induce a smaller effect. Partial agonists may act either as an agonist or antagonist. If no full agonist is present, they act as an agonist. If full agonist is present, they act as antagonists. Here is agonist A and agonist B. Agonist A is full agonist. Agonist B is partial agonist. When they use alone, they could produce effect respectively. Partial agonists could produce a smaller effect than full agonists. When they use together, the full agonist response reduces. For the partial agonists compete with full agonists to bind to the receptor but produce a smaller effect. So, if full agonist present, partial agonists act as an antagonist. Look at the graph. The filled square is full agonist. The open square is partial agonist. When they use alone, they could produce response respectively, but the partial agonists produce a lower maximal response. Look at the graph C. Simultaneously treatment with single concentration of full agonists and increasing concentration partial agonists. The abscissa is the concentration of partial agonists. The ordinate is the response of single concentration of full agonists. While the concentration of the partial agonists increase, the response of single concentration full agonists decrease. As the increasing concentration of partial agonists compete to bind to the receptor with increasing success. The filled triangle is the sum of response of two drugs, and here is the total response.